You're still watching Breakfast Central. Let's still stick with Nigeria this time. Resident doctors in the country are in the 9th day of their infinite strike. Now, since the start of the industrial action, it has been a battle of words between Resident Doctors Association of Nigeria and the federal government, as issues of poor pay, deplorable health facilities, among others, remain the root causes of the strike.
Now, News Central Mary Chinda brings us up to speed on the situation at some hospitals within the commercial city of Lagos in this report.
Hospital, Lagos Island, crammed with patients, doctors and non-medical staff. Despite the strike action, the hospital is abuzz. News Central is barely allowed to film. Meanwhile, at the Lagos University Teaching Hospital, Bluff, the situation is different, as parts of the usually busy hospital look scanty. It is day 8 of the strike action, and the doctors are saying they are not backing down in any way. We're actually at the conference room of the Association of Resident Doctors right here at Bluff, and that's because the University Teaching Hospital would not let the media in, so we had to sneak into this secretariat to be able to find out what's going on, especially since the government has threatened that if the doctors do not go back to work, they will not be paid. However, the tempo here is that the doctors are still not going back to work. They are calling the federal government of Nigeria's threat a bluff, and they're saying there is no going back to work just yet. The president of the Association of Resident Doctors speaks to us.
The situation is still the same. The strike continues. Presently within the hospital, there are no resident doctors because the directive from the Nigerian Association of Resident Doctors is still that nothing has been achieved, and as such, the strike continues.
The doctors have made firm their demands. Improved welfare and standard medical facilities top their list.
There are 13 doctors leaving the country every week. As we speak now, more than 50% of registered Nigerian doctors are outside the country. This is rather unfortunate. People that have been trained to give quality health care to Nigerians are no longer here because their welfare is not well taken care of. For example, in Lut, we've not had call food for more than 22 months, meaning that if a doctor is on call, there won't be food for the doctor. Doctor will have to look for food around instead of attending to patients at night. Most of the rooms we stay when we are on call, which we call call rooms, are in deplorable state. These are some of the issues fueling the brain drain that we presently witness in the country. For us, it is a no retreat, no surrender, until government fulfill its promises that was signed in the memorandum of action. We will never back out on this strike.
On Sunday, the Nigerian government, through the Minister for Labour and Productivity, Chris Ngige, made it clear that it is no longer willing to dialogue with the striking doctors. Mary Chinda for News Central.